Maeliki Latif has been in hospital for 5 months. He's had 2 spinal surgeries. He says a strike by Nigerian doctors 7 weeks ago has slowed his recovery. He's being cared for primarily by nurses and an occasional visit from a consultant.
I have family which I have to maintain. And they're supposed to have been discharged if things work well. But here, in Nigeria, they don't recognize human beings.
Public hospital wards that are usually overflowing now look like this. Doctors in the public sector have been on strike since July 1st. They're demanding better pay and improvements to hospital structures and working conditions. Critics say the industrial action is selfish, especially as Nigeria confirmed its first case of Ebola a few weeks into the strike. But the doctors insist this was the only way to draw the government's attention to what they say is a faltering healthcare system.
When you don't assume the role you ought to pay in patient care, then the patient care suffers. So in fact, the fundamental base of all the struggle is to make sure that patient care is improved.
Although it's Africa's largest economy, Nigeria's healthcare is criticized for lagging behind. Issues range from lack of funding to poor equipment and services. Some $500 million are lost every year to medical care sought by Nigerians overseas. And many Nigeria-trained doctors practice abroad, leaving the country in need. Nigeria has a chronic shortage of doctors. There's 1 doctor for every 6,000 patients. The World Health Organization recommends a standard of 1 doctor for every 600 patients. The government says it's been trying to expand medical schools.
You need teachers. And if the teachers are not there, it's not just enough to establish medical schools. But the truth is that we're encouraging not only government medical schools, but even private medical schools to try as much, but they have to maintain standards and try to bridge the gap.
Officials in Lagos say they've trained 800 volunteers to deal with Ebola, but the federal government says the strike has not affected its ability to handle the limited outbreak in the country. While Nigeria has been commended for so far being able to contain the deadly disease, much more needs to be done to fix its healthcare system as a whole. Rawi Rageh, Al Jazeera, Lagos.